The American Public Health Association is committed to improving public health and achieving equity in health status. This year, we are incredibly excited to welcome all our members back, virtually and in person, to Denver to share the latest in research and public health leadership. This is APHA TV. Welcome back to the APHA virtual studio as the public health community gathers in person and virtually for another exciting day of learning and sharing knowledge. Today, we will be bringing you insights into what's happening on site at the meeting as APHA TV co-host Dina Baer joins us to bring us all the very latest from Denver. Dina, how are things looking from the convention center?
Thanks, Atria. Well, as we all know, coming to in-person meetings has been a major undertaking, but the public health professionals here are doing a great job of staying safe and getting back to what they do best, sharing great research and best practice.
Fantastic. And what have you got in store for us today?
Well, today I stopped by the opening keynote session, Strengthening Social Connectedness Across the Racial Divide. Watch out for highlights of that.
We're all in it together, and together, I think we can do this in solidarity.
We also sit down to discuss reproductive rights with Dr. Rebekah Gee.
Our efforts to reduce maternal mortality.
Keep watching for a conversation on the 100th anniversary of the Maternal and Child Health section with Dr. Nancy Cheak-Zamora.
We really define MCH as the whole family network.
Great work, Dina. Keep watching for all of that. And remember, throughout the show, we will be looking at some of the work being done by centers across the United States in cancer and disease prevention. And we also want to remind you about all of the in-person and virtual activities planned for today, including presentations in the Exhibitor Expert Theater, coffee chats, and the Social Media Lab session. Be sure to dive into the meeting schedule for more information.
I just heard Heather McGhee, the keynote speaker, and it was very inspiring and very compelling.
Our collective progress in our society is being held back by a story, by a lie. And the lie is the lie of the zero sum.
It was really inspirational, a lot of focus on how racism is deeply embedded in a lot of the social and public health problems that we're facing today.
Racism is at the core. It is the core dysfunction of our society.
Racism just doesn't affect Black African American people. It affects us all. And as an Asian American, I can relate.
If you take this zero sum lie to its real world application, chaos ensues. And that's what I found in a journey that I took to Montgomery, Alabama. This story of what we can do together, of solidarity dividends, reversing the tide, refilling the pool of public goods, is one that I believe is the story of our current era.
I think it gave everybody the realization that we're all in it together, and together, I think we can do this in solidarity.
It's not just about shots. It's not just about medicine. It's about healing our entire social body. And we can only do that together.
Heather's keynote address was absolutely inspiring, solidifying, grounding, and my cup is getting filled back up.
For the first of our featured centers, it is the Medical University of South Carolina Hollings Cancer Center. Let's take a look at how community engagement is integrated into their mission.
Our community partners help to inform the agenda. They let us know whether our priorities are in line with the community's priorities, and if not, then how we can align those priorities.
Dr. Ford is actually a superhero here. She's inspirational to her students and her postdocs and others that work in her program because they can see how much good she can do, how that energy and optimism really has an impact.
We're so pleased with the progress that many of our students have made who are now studying health disparities and really carrying the torch to find strategies to improve health outcomes for all populations.
And we are now joined by Dr. Rebekah Gee, former Secretary of the Louisiana Department of Health and now current CEO of Healthcare Services for LSU Health. Welcome, Dr. Gee.
It's wonderful to be here. Thanks for having me.
Dr. Gee, you helped to establish one of the first state-run perinatal quality collaboratives focusing on maternal mortality. Tell us more about why that was needed and what it means for women giving birth.
Sure. So unfortunately, in the United States, we have some of the worst outcomes in the developed world. So we set out to use data to inform our efforts to reduce maternal mortality. We found that most preventable deaths were because of hemorrhage that went improperly cared for. So you had women bleeding too long, you had women who were not given the right amounts of blood, you had not the right types of things at the time you needed them, all in one place, like a hemorrhage cart. Didn't have training so that people knew how to work together as a team. And we fixed all of these things and we had remarkable outcomes.
What do you think are some of the most pressing reproductive health challenges that we face today?
Well, first and foremost, intractable rates of unintended pregnancy. Half of pregnancies are unintended. We're not doing a very good job there. We need to do better. We also need better contraceptives. We don't have great contraceptives for men. We haven't had a lot of progress since the 1970s with new mechanism for contraceptives, and we need to do better. That means both private and public sector investments, new ideas, bolder innovation. Number two is that we have some concerning politics in the United States around reproductive health. We have unprecedented levels of involvement of legislative bodies in the decisions between doctors and patients, particularly as they relate to pregnancy termination. And then I think finally, we have a sexually transmitted illness problem in this country. We still have babies born in this country with syphilis. That just shocked me when I got to Louisiana, that we had congenital syphilis in the 2020s. And that just needs to stop.
As Secretary of Health, you oversaw both the Office of the Department of Health as well as Medicaid. How did you align the often encountered silos between the two?
Public health ought to be the orchestra conductor for the healthcare symphony. Public health ideas, the public health data, the public health leaders have the holistic picture of what needs to happen and ought to be at the table for those decisions. And so public health needs to have a bigger seat at the table. If public health's not invited, public health needs to pull one up. And I think we ought to learn from what's happened with COVID. This COVID should be our public health wake-up call that we need to change.
You have served in numerous state and national policy roles. Do you think that there should be more clinicians trained in health policy?
I think it's really important to have people who are taking care of patients who actively understand what the healthcare system is like to be a part of it. In its brokenness and in all of its successes, I think informs public health. But also, I always tell people, don't become a doctor or nurse just because it looks impressive or you think it's a good idea. Do it because you like taking care of people. But for me, the caregiving, what I've learned from being a caregiver, merged with public health, both of those things powerfully inform how I do policy. And I do think that the merging of those two is the optimal perspective.
Dr. Gee, thanks so much for your time today. We really appreciate it.
Thank you. Thanks for having me.
APHA TV is brought to you from the 2021 APHA annual meeting. You can find us in person at the Colorado Convention Center, in select hotels, and on the homepage of the meeting platform, as well as on our YouTube channel and Twitter feed. Next up, we head to the Zoo Family Center for Global Cancer Prevention, whose mission is to improve access to cancer prevention and early detection.
The greatest disparity in cancer deaths occur in cancers that are most preventable. Black women over the age of 50 are more than twice as likely to die of breast cancer than white women. And for Black men, they are more than twice as likely to die of prostate cancer than their white counterparts.
Some of the reasons are socioeconomic. In fact, I've heard someone say with a prostate cancer diagnosis, the biology isn't going to determine your outcome as much as your zip code. If we think about how we can more effectively get people that are at high risk into screening protocols that are tailored for them, I think we can do a better job at addressing some of these disproportionate numbers.
We are engaged in innovative research that will level the playing field for all groups, because all people deserve to lead a healthy life.
And now, some of the participants from one of APHA's featured sessions, Lessons Learned, How We Can Better Respond to the Next Pandemic. Join APHA TV to give us an overview of the session.
Hey, it's Georges Benjamin here again. I just want to talk about and give a shout out to one of our featured sessions when we're going to talk about how to really rebuild the public health system that we all deserve. We're going to have our good colleague, past President Dr. Virginia Kane, and then a member of the board, Dr. Kathy Troce, to talk about this very, very important process that we need to go. You know, that's the big issue for us now, how to make sure that we build a public health system that we all deserve.
I think we need to understand that responding to a pandemic is not just a technical issue. Certainly the science is important. It's also a political issue, a social issue. We need to fix our public health infrastructure for sure, but we also need to pay attention to the social determinants of health and how that has affected not just individual people dying, but spread of the virus throughout the community.
I thought we were doing fantastic because we were providing health materials at third grade levels, and yet to find out that we have a significant population in Indianapolis that cannot read at all. So how do you register for COVID-19 testing? How do you know where to go for COVID-19 vaccinations if you can't read?
We need to get back to worrying about community rights, not just individual rights. And we need better surveillance systems for when a spillover event occurs. There's a lot of work that needs to be done.
It all has to do with trust and respect for each other. And that takes engagement with the community.
People should come to our session because this is a really important topic, and we will have a very robust discussion about how we can better prepare.
Now to UT Health, where the Center for Health Promotion and Prevention Research is developing health promotion and disease prevention programs in all parts of Texas.
We're involved in preventing disease, promoting health, and also assisting in disease management. And we do this at all levels of the community, the individual, in organizations.
We strive to develop multi-level interventions that can not only influence people's behavior, but also can change their environment to help them be more healthy.
Prospective students get really excited when they hear about all the different topics they can work on. They can study from one of 6 cities across Texas, including Houston, which is the most diverse city in the United States. It's also home to the largest medical center in the world. So the opportunities for research and collaboration are endless.
I just really love our involvement with our community. So we're always in the community conducting interviews, surveys.
Just knowing that, you know, you're working towards something bigger, all the little things that can make a big difference.
The University of Rochester Medicine Recovery Center of Excellence was established to address the harmful effects of substance use disorder in rural Appalachian communities. Let's join them to hear more.
The UR Medicine Recovery Center of Excellence was first established in 2019 to address the issues with the opioid crisis in Appalachia, in particular in 23 counties that are most impacted by this crisis due to poverty levels, other determinants of health that make them more susceptible to this crisis. And they also have lack of care, lack of access to care, transportation and distance challenges and so forth that make it difficult to get their treatment as needed.
The ecosystem of recovery is a framework for establishing a system of care. The first piece is around saving lives. An example of that might be naloxone. The second component is around engaging the community. The third component is increasing access to treatment. The fourth component is around increasing screening for mental health and substance use disorder. And finally, we need to have systems of care for patients who are in their recovery.
For more than 4 decades, McGruff the Crime Dog and the National Crime Prevention Council have been helping Americans take a bite out of crime. Let's hear more about their public health movement in our final feature.
For more than 2 generations, McGruff the Crime Dog and the National Crime Prevention Council have worked with a wide range of community organizations, the U.S. Department of Justice, and the Bureau of Justice Assistance to reduce violent crime by bringing the police and communities closer together. As public health leaders, join us. Working with the U.S. Patent and Trademark Office, a new campaign, Go For Real, is giving teens and tweens the tools they need to spot fakes.
So why don't you tell us which one is real, which one is fake, and then the differences that you notice between the two.
The real ones are these, and these are the fake ones.
One of the more insidious growing threats to young people is the overseas manufacturing of illicit vaping products. It undermines prevention efforts aimed at children and presents additional health risks to adults. The National Crime Prevention Council is working with law enforcement agencies, prosecutors, and others to stop this criminal enterprise dead in its tracks. Let's work together. McGruff, tell them what we need to do.
Help take a bite out of crime.
The Maternal and Child Health section of the APHA is celebrating its 100th year anniversary. So here to tell us more about how this section has evolved is the chair of the MCH section, Dr. Nancy Cheak-Zamora. Thank you for being here, and thank you for all you do for women and children in our country.
Oh, thank you so much for having us.
So talk to me a little bit about the key focus in maternal and child health right now.
Absolutely. Well, we are much more than just women and children's health issues. I think we really define MCH as the whole family network, whatever that looks like for that family member and how they define it. And we really want to think about all of the things that come into making sure that they're having a healthy lifestyle as well as thriving in their community.
Clearly, the pandemic has been a huge challenge, and it kind of hyper-focused everything, especially with regard to vaccines and keeping people healthy and trying to avoid COVID. But how has this section really evolved from other issues throughout the years?
You know, I think in the beginning, right, it was a lot of white women taking care of white families. But, as early as 1950, we really started making some serious advocacy against segregation. We wrote a policy for APHA to eliminate segregation in family clinics. So we really expanded from just this very closed idea of what a family is to expand that.
Because that's even changing now. Some great achievements when you think about what you have given to empower families and keep children especially safe because of that. As you look ahead to the future, what do you think will be the greatest focus and perhaps the biggest challenge?
It's really important to develop our future practitioners. So making sure that we're there to support our members. We have over 1,000 members in just the MCH section. So we really want to understand what they need so that they can do their job. So that's why we have the mentorship program. That's why we have the fellowship program, so that we can really provide them the training and the supports that they need.
With regard to patients, what are some of the caregivers hearing from patients are their greatest concerns right now?
Yeah, I think it is access to good information. I think we really need to be thoughtful about how we communicate with our patients and just people in our communities, making sure that we're doing a lot more listening maybe even than we're doing talking, understanding what their fears are, and then talking through what we know and what the data really tells us about that.
It's so important. So glad you are there.
Thank you.
Dr. Nancy Cheak-Zamora, thank you so much.
Have a great day.
Thanks, Dina and Dr. Cheak-Zamora. Some really important work from the Maternal and Child Health section. That is it for today, but there is still plenty more to come. Tomorrow, be sure to join us back in Denver for a few more APHA featured session previews and an interview with Kelly O'Brien on advocacy and social connectedness. And don't forget, you can find us here in the Colorado Convention Center, as well as in select hotels, always on the virtual platform, and of course, you can find us online. Until next time, goodbye.